So, have you been getting pain, numbness, tingling, maybe even weakness down one of your arms, maybe some tingling or burning or numbness in your fingertips, some neck pain, some pain or burning down by one of your shoulder blades? Maybe you've seen your doctor, you've had an MRI, and it says you have a C5-C6 disc herniation or a C5-C6 disc bulge. And you're maybe wondering, what the heck does that mean? What exactly is that? This is something we see often in our office. Patients have been given a diagnosis about a problem and they don't really understand what it means. And what we found is that when patients understand what's going on, what their problem actually is, they get better faster because the treatment makes sense, their exercises make sense, and they do the things to help themselves. So if you've been diagnosed with a C5-C6 disc herniation or C5-C6 disc bulge, and you're wondering what that is, then stick around for the next few minutes because I'm going to give you that full explanation so you understand exactly what's going on and why you're getting the symptoms that you're getting, and that's going to help you on the path to getting better sooner. Hi, my name is Dr. Scott McCrimmon, and I'm a chiropractor in Caledon, Ontario, Canada. Over the past 20 years, I've been very fortunate to be able to help thousands of patients and their family with varying health conditions. This channel is dedicated to giving you the information to help keep you and your family healthy, pain-free, and living an active lifestyle. So, if you're happy with the information you see here, be sure to give us a like, click the subscribe button, and turn on that notification bell so you can stay up to date with the latest information and our newest videos. Okay, so C5-C6 disc herniation or C5-C6 disc bulge. Let's understand exactly what that is. To begin, we need to go over a little bit of anatomy so we know the different parts of the spine. So when we look at our spine from the side here, this part is our neck. So this is the base of the skull, and these first 7 vertebrae or first 7 bones are our cervical or our neck vertebrae. So we call them C1, C2, C3, C4, C5, C6, and C7. In between those vertebrae sit our vertebral discs, and they're labeled according to the vertebrae that they're in between. So this disc here would be our C2, C3 disc. This one down here would be our C6, 7, and this is the one we're talking about, our C5 and C6 disc, okay? The other important structures that we need to know when we look at this are these yellow things here, okay? There are spinal nerves. Our nervous system is what is our communication system in our body. So it is how our brain, which sits up here, communicates with our body by sending signals down our spine, out these nerves which go to every part of the body. The ones in the lower part of the neck, they typically have a lot to do with our arm, okay? A little bit in our upper back, but the arm. And so if they're irritated, that's why you're gonna get some of these symptoms down the arm. So if we're talking about a C5-C6 disc herniation or C5-C6 disc bulge, we're talking about this disc here and usually the nerves that come out beside it there, so our C6 nerve root. So to give a little bit better picture of exactly what's going on with that disc, I have this model here. So this is our vertebrae, and this is the disc above and the disc below. And what our discs look like is they have a harder outside that we call the annulus, and they have this red stuff in the middle that's called the nucleus, which in a perfect world is nice and circular right in the middle of that disc. But through various causes and injuries, the nucleus can start to squish out to the side. So I call this the jelly donut effect. So if we think of this disc as a jelly donut, we have the harder outside, the annulus, which acts as the outer part of the donut, and the nucleus, which acts as the jelly inside the donut. Now, what can happen is our jelly can squish out of the donut. Okay, so you can see that here with our red and our jelly squishing out, and then it can start to put pressure on that nerve that we talked about. The jelly and the nerve don't get along, they're kind of toxic to each other, so it often creates a lot of pain and discomfort, and could also be numbness, tingling, weakness, wherever that nerve goes. And as we mentioned, the nerves in the lower part of our neck, they tend to do things down our arm. Okay, so if we have the jelly squishes out of the donut, that is what is called a herniated disc, and that is where some of your symptoms start. The flip side of that we talked about is a bulging disc. Okay, so we mentioned that a little bit earlier as well. A little bit different effect, but since I love food analogies, instead of a jelly donut, we're gonna think of our disc like an ice cream sandwich. So if this is the two outer pieces of our ice cream sandwich and the disc is the ice cream itself, you can picture squishing down an ice cream and what's gonna happen to that ice cream. Okay, it's gonna start to squish out the sides. Again, the bulging ice cream can put pressure on the nerve and we can start to get symptoms where those nerves go. Not often as painful as a herniation, but nonetheless can still create a lot of pain and disability there. So the way we test for these nerves is we know this C6 nerve does things down our arm, okay? The 3 most common things that we test when we're looking at nerves are our sensation, our muscle strength, and our reflexes. So at your healthcare provider's office, they may have done some things where we've taken the reflex hammer out and tap on your bicep or your forearm or behind your elbow to see if you get that reflex. Just like when they would tap, if they would tap on your knee and your foot would jerk up, you get the same thing in your arm. So a C5-C6 disc herniation most often creates a weakness in that biceps reflex. So they'll tap it and maybe it doesn't jump or move quite as well as the other side. When we look at strength, the most common nerve affected in a C5-C6 disc issue is our bicep muscle. So that's the muscle on the front of our arm here. So you may notice you have some weakness compared to the other side in bending your elbow or trying to lift something or hold something up. The last part is skin sensation. Okay, so that might be, again, your pain, your numbness, your tingling. Most common with our C5-C6 nerve, our disc herniation, is going to be our C6 nerve, which supplies down this part of your arm and to mainly the first two fingers. Now, if there's pressure on other nerves, it might be your middle finger, your outer fingers, pain down the back of the arm, depending on what nerve is affected. But most common, people feel it across the forearm and into our first two fingers. Often the longer the pressure is on that nerve from the disc, or the more severe that pressure is, then often the worse the symptoms will be. The good news is, with proper treatment, understanding what's going on and doing the right exercises, these problems get better. We see it all the time in our office, and we're always happy to share treatment tips, exercise tips, but that's not the focus of this video. The goal of this video was to give you the information to understand what a C5-C6 disc herniation or disc bulge is, so that you can start your road to understanding what your problem is and how you're going to get better. Be sure to check out our next video on where do these C5-C6 disc herniations or disc bulges come from, so you can help understand some prevention and help other people as well. And check out our other videos about some of our home exercise tips for C5-C6 disc herniation. So if you like this video, be sure to give us a like, hit the subscribe button, and turn on those notifications, and we'll see you with our next video.